Hi, my name is Brett from Real Response, and I'm just going to be taking you through how to conduct your primary survey for your assessments for your online virtual course coming up soon. Thanks. So what we're going to touch on now is your primary survey, or what you need to conduct for your assessment. I'm going to do a full run through and talk through of what each step and what's involved with each process. So what we're going to look at is your doctors, A, B, C, D. D being danger, R being response, S being send for help, A for airway, B for breathing, C for CPR, and D for defib. So first of all, we're looking at danger. The number one priority here is yourself, your bystanders, and then your patient. So doing a quick 5-second scan around the room to making sure that your life is not in any immediate danger before you start to treat. What we're going to move on to is response, where we want to get a response to ascertain the conscious state of our patient. We're going to look, are they alert? Do they respond to my voice or any noise? If they're not responding in that way, a light shake or a squeeze on the trap muscles. If they still are not responding, we can assume that they are unconscious and unresponsive. From there, we're going to jump straight on the phone and dial 000 or get a friend to call an ambulance so they can get some help on the way. So once we've sent for help and we're happy that an ambulance is on the way or someone's to come in to provide assistance, we're going to move straight into airway. From here, we're going to put a hand on the forehead, a hand on the chin, and pull down to have a quick look in to make sure there's no objects in there. Once we're happy the airway's clear, we want to put a hand underneath the neck, a hand on the forehead, and just tilt it back ever so slightly. From there, we're making sure the airway is open so we can move straight into breathing. From here, we're going to place a hand on the diaphragm or the belly and put our ear next to the nose and our face next to the mouth, and we're going to look, listen and feel for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If you feel that they are not breathing normally, we're going to move straight into CPR and we're going to call for a defib. From here, we're going to find the lower part of the sternum in the center of the chest and place the base of our palm on the lower part of the sternum in the center of our chest. We're going to be up on our knees with our arms locked out, and we're going to go straight into compressions, doing 30 compressions to 2 breaths at a rate of 120 compressions a minute, and ensuring we're compressing the chest down about 5 centimeters. To make sure you're doing this correctly, you should see 2 green lights in the collarbone here, and that will indicate that you're pushing effectively. To 9:30. Once you get to the breaths, you don't have to do them if you don't want to, but if you can demonstrate pinching the nose, tilting the head back with your pistol grip, and doing 2 breaths off to the side before jumping straight back in. So once we've identified the patient is not breathing normally after checking for 10 seconds, we're going to go straight into CPR, and we're also going to call for a defib. If you have a defib available, we're going to open that straight up and we're going to listen to the prompts and put those pads directly on the chest.
Remove square package from the lid of the AED. Peel one of the white pads completely from the blue plastic. Peel one of the white pads completely from the blue plastic. Firmly place the pad without the blue plastic on the patient. Next, peel the second white pad from the blue plastic. Firmly place the second pad on the other location. Firmly place the second pad on the other location. Do not touch the patient. Analyzing rhythm. Shock advised. Do not touch the patient. Shock will be delivered in 3, 2, 1. Shock delivered. Start CPR. Press, 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 press.
put those pads on, you're just going to follow the prompts of the defib machine until it tells you to stop touching the patient so it can analyse. You're going to go for a full 2 minutes of CPR so we can show you that you can do this effectively and appropriately and sign you off on your assessment. I'm walking in and I've seen a patient that's collapsed on the ground, so immediately I'm just going to quickly check for danger to make sure that I'm not in any immediate danger. And check for a response. Hey, can you hear me? Open your eyes, squeeze my hand if you can feel that. There's no response, so I'm going to call an ambulance very quickly and put it on speaker and continue my assessment. Move straight into airway, pull the chin down, have a quick look in. Cool, I can't see anything in there, so I'm going to open that airway with the head tilt chin lift, put my hand on the belly, my face near the mouth, and check for breathing for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. They're not breathing normally, so I'm going to go straight into CPR and try find a defib somewhere. I can see a defib nice and close by, so I'm going to quickly stop CPR and put those pads on nice and quickly.
Remove square package from the peel one of the white pads completely from the blue. Firmly place the pad without the blue plastic. Next, peel the second white pad. Firmly place the second pad on it. Do not touch the patient. Analyzing rhythm.
I'm now going to follow the prompts of the machine.
Shock advised. Do not touch the patient. Shock will be delivered in 3, 2, 1. Shock delivered. Start CPR. Press, 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 press. Give breath. Give breath.
Okay, I can see my patient is slowly starting to wake up, and I'm going to quickly put them into the recovery position to make sure their airway stays clear. From here, I'm going to start from danger again, go through check response, make sure that ambulance is still coming and provide some updates, check the airway to make sure it's clear and there's nothing blocking it, and do a quick assessment on the breathing whilst talking to my patient to make sure they're feeling okay.